Welcome back everyone. Now we are going to continue with the anatomy. In this section we are going to deal with the blood supply of the inner ear. And this approach is going to be a little different. We are going to take a tour of the blood supply all the way from the heart and back to the heart. And on the way we will also see some of the key features which can impact on inner ear function. So when we go studying the blood supply of the inner ear, actually the blood supply starts all the way from the heart, and therefore we are going to start the tour from the heart. So when we see the heart, from the heart we have the ascending aorta and the arch of the aorta, and from the arch of the aorta on one side there is the brachiocephalic artery, also called as the innominate artery by some authors, and from here on the right side we have two main branches. One is the subclavian artery and the common carotid artery. On the left side, the subclavian artery and the common carotid artery are direct branches of the aortic arch, whereas on the right side they are branches of the brachiocephalic artery. So, where does the inner ear supply comes from? It actually comes from an artery that takes origin from the subclavian artery, as can be seen here. So, this is the arch of the aorta which I have represented. Then we have the brachiocephalic trunk, and then there is the carotid, the common carotid artery, and the subclavian artery. The subclavian artery gives rise to multiple branches. One of the first branches, and a very big branch, is the vertebral artery. It is this vertebral artery which again goes back up to supply the inner ear through its branches, which we will see in detail. Now, because the vertebral artery branch supplies both the inner ear and also a significant part of the brain stem, afterwards it forms the basilar circulation, we'll come to that. So, it is a very important artery for both the inner ear and the lower part of the brain stem and the cerebellum. Now, there is one condition that we should be aware of in this origin. So, this vertebral artery comes from the subclavian artery. Now, if the proximal part of the subclavian artery, just before the origin of the vertebral artery, just before the origin of the vertebral artery, if that is blocked, then in case of vigorous hand movements, there is a possibility that the blood supply to the subclavian actually does not come directly from the heart ear, but actually all the way from the circulation that reaches the brain. So we have the common carotid, then which goes as the internal carotid, then the opposite side vertebral. All these things take the blood to the brain, and then from there is a reverse flow in the vertebral artery which will be supplying the hand, the upper limb. So in that case, where there is a blockage, either partial or complete blockage of the first part of the subclavian artery, there is a syndrome called subclavian steal syndrome, which will lead to brainstem signs and also signs related to inner ear dysfunction. Now, after the vertebral artery takes origin from the subclavian, then what does it do? There is another significant relationship that we need to know. The vertebral arteries, both on the right and on the left, pass through the transverse foramina of the C-spine. So multiple transverse foramina. You can see there are holes here. It actually goes through those holes one above the other. So this is again a very important relationship in a condition called as rotational vertebral artery syndrome, because at this location there is a possibility of kinking of these blood vessels when the person turns to the right or turns to the left. When the head is turned to the right or to the left, there is a relative movement. There is going to be a rotation of this cervical vertebrae, one on top of the other, which leads to kinking. If both are patent, then kinking of one blood vessel may not be important. But if one of them is already blocked, when the head turns and it leads to kinking of the other blood vessel, then there are going to be symptoms related both to brainstem dysfunction and also inner ear dysfunction, as seen in rotational vertebral artery syndrome. So we saw how it started from the heart, subclavian. The vertebral artery was a branch of the subclavian. It passed all the way through the foramina and then enters the foramen magnum to go into the intracranial cavity. After it goes into the intracranial cavity, then what will happen? The vertebral artery on one side merges with the vertebral artery on the other side to form the basilar artery. The vertebral artery itself, will give rise to what is called as a pica, posterior inferior cerebellar artery. Then the basilar artery gives rise to, in addition to multiple pontine perforators, it gives rise to something called a ICA, anterior inferior cerebellar artery. And this anterior inferior cerebellar artery is the blood vessel which gives the labyrinthine artery which supplies the inner ear. So we have traced all the way from the heart to the ICA and into the labyrinthine artery. And up top we have the superior cerebellar artery in either side, which are one of the terminal branches of the basilar blood vessel. Then we have the circle of Willis, which will come beyond that. So this is a more labeled diagram to show the same thing. So we have the basilar, we have the vertebral artery in either side, we have the posterior inferior cerebellar artery, then we have the anterior inferior cerebellar artery, and then the superior cerebellar artery. Then after that it becomes the circle of Willis, and one of the branches from the circle of Willis is the posterior cerebral artery. So here the main thing here is the anterior inferior cerebellar artery, which gives the labyrinthine artery which supplies the inner ear. Also we need to note how these main blood vessels, the superior cerebellar, the anterior inferior cerebellar and the posterior inferior cerebellar artery are related to the brainstem and cerebellum. So that is what is shown in this particular diagram. So we have the posterior inferior cerebellar artery branches that are direct branches coming from the vertebral artery in east side. Then we have the anterior inferior cerebellar artery and of course the superior cerebellar artery. So we have anterior inferior, superior cerebellar and the posterior. So the nodulus of the cerebellum, which we will be dealing with later in clinical conditions, will get supply from this pica, posterior inferior cerebellar artery. Also this pica supplies the lateral part of the medulla, lateral medullary syndromes will be there. The ICA itself, will supply the lateral part of the pons and upper medulla, and then we have the superior cerebellar artery which will supply the lateral part of the midbrain. So superior cerebellar artery, lateral midbrain syndromes, anterior inferior cerebellar artery, ICA, it is lateral pontine syndrome, and posterior inferior cerebellar artery is leads to the lateral medullary syndrome in case of infarction. This is what. Now what we will do, we will take a more detailed approach to the actual inner ear from the anterior inferior cerebellar artery, which gives the branch, that is the labyrinthine artery. So the labyrinthine artery chiefly divides into common cochlear and anterior vestibular artery. We have to note from here onwards that the blood supply, and when we deal with the nerve supply, the blood supply, especially the arterial supply and the nerve supply, almost mimics one another, and therefore it is so difficult to differentiate when the inner ear is affected, either whether because of a arterial infarction or because of a neuritis. We will see that a little later. So anterior vestibular artery branch, it divides the labyrinthine artery and the common cochlear artery. The common cochlear artery itself gives the main cochlear artery, then the vestibulocochlear artery. So the vestibulocochlear artery gives a cochlear ramus and then also divides into posterior vestibular artery. This posterior vestibular artery supplies the saccule and also the posterior semicircular canal. We have to note when we see the nerve supply later on that this supply to the saccule and the posterior semicircular canal in the nerve supply will be the inferior vestibular nerve. So that nerve supply and this arterial supply almost mimics. When it comes to the anterior vestibular artery, it will supply the main part of the utricle, the anterior or superior semicircular canal and also the lateral semicircular canal. So this is the arterial supply of the inner ear. We have traced all the way from the heart arch of the aorta, then either directly from the aorta or from the brachiocephalic trunk, depending on right or left. On the right from the basic brachiocephalic trunk, on the left directly from the arch of the aorta, we have the subclavian blood vessel. The subclavian gives rise to the vertebral artery. The vertebral artery goes through the cervical spine foramina, transverse foramina. Then it enters the foramen magnum and goes into the intracranial. The two vertebral arteries meet to form the basilar artery. In the basilar arteries, one of the main branch is the anterior inferior cerebellar artery. The anterior inferior cerebellar artery gives rise to this labyrinthine artery, and then we have seen the blood supply of the labyrinthine blood vessel. Now coming to the venous drainage. When it comes to the venous drainage, we have something called the vein of the cochlear aqueduct and vein of the vestibular aqueduct. The vein of the cochlear aqueduct supplies the central part of the sensory structures. What do I mean by that? The ampulla of the semicircular canal. In the ampulla of the semicircular, we have the cristae. Then in the utricle and saccule, we have the maculae, the main sensory part. The central part of the sensory part of this cristae. Here we have the blood supply, the venous drainage by the tributaries, which will ultimately end in a vein called vein of the cochlear aqueduct. All these branches will end up in vein of the cochlear aqueduct. The peripheral part of this sensory structure, the cristae and maculae, other than the central part, a little bit peripheral part, and the remaining simple walls of the endolymph, like the duct proper of these things, the remaining areas of the walls of this endolymph containing saccule, utricle, and also the semicircular, all these things are drained by the vein of the vestibular aqueduct. Vein of the cochlear aqueduct actually passes in the cochlear aqueduct, the bony osseous cochlear aqueduct. This is, you can see here the perilymphatic duct. So along with this, in the same bony canal, whereas the vein of the vestibular aqueduct, though the name is such, it will not occupy in the same bony canal, it will run a little bit adjacent to that, but then again ends up within the dural folds. So vein of cochlear aqueduct, vein of vestibular aqueduct. What we see here is vein of cochlear aqueduct drains the central part of the sensory structures, that is the cristae, and peripheral part of the sensory structures is again drained by the vestibular aqueduct. In addition, vestibular aqueduct also drains the remaining part of the endolymph chamber containing simple walls of the endolymph containing chambers. So what you saw here is the sensory structures have a dual venous drainage, both from here and here. The cochlear aqueduct taking care of the centralmost part and the vestibular vein of the vestibular aqueduct taking care of the peripheral part of this. Then from here what happens is, here is depicted vein of the vestibular aqueduct termination. Different authors come up with a different termination. One of the terminations that is given here is either in the inferior petrosal sinus, the jugular bulb, or in the sigmoid sinus. This is for the vein of the vestibular aqueduct. The vein of the cochlear aqueduct ends in the inferior petrosal sinus itself. So this is where they end. So from there what happens is, these are the dural venous sinuses. So the venous drainage is ultimately into the dural venous sinuses. In this picture we have depicted intracranially, from an intracranial view of the dural venous sinuses. In the lower part of the picture we can see the inferior petrosal sinus coming and all the way coming and joining the sigmoid sinus or jugular bulb into the jugular bulb region, and then here is the sigmoid sinus which ends in the jugular bulb. So the inner ear blood supply goes into the dural venous sinuses, which are venous channels within the folds of the dura. So this is how the venous drainage of the inner ear happens. Then from there the jugular bulb, and then there is an internal jugular vein. So the internal jugular vein goes all the way down in the neck. The internal jugular vein is joined by the subclavian vein on one side. Both of them form the brachiocephalic vein, the brachiocephalic vein on the right side, the brachiocephalic vein on the left side, both of them join together, both the brachiocephalic on the right and the left, both of them join together to form the superior venae cava, and that ends up in the heart. So we took a tour of the entire blood supply. We took a tour of the blood supply starting from the arch of the aorta all the way to the inner ear, and then from beginning the venous drainage from the inner ear, we traced it back to the heart. We did this because there were important correlates that we needed to know, some of the relationship of the adjacent structures that is supplied in the brainstem, the relationships that we needed to study in the course, when it comes to the course within the C-spine, the foramina of the C-spine, the transverse foramina, and then also in relation to understanding the subclavian stele. So this is why we needed to take this long tour of the blood supply of the inner ear. Also we saw the blood supply of the inner ear will mimic, especially the arterial supply will mimic the nerve supply, which we will be seeing in a later lecture. So with that we complete the tour of the blood